I come from a border, so I like to share my life history from starting from the border and where we have reached in AIIMS Jammu. So I come from a very small village that is Adi in district Poonch and located at the LOC, that is the border. For most people, living on the border means living with the limits of opportunities, limits of access, and limits of dreams. But my life taught me one thing: boundaries are not walls to stop us, they are milestones to cross. Let me tell you about my journey from borders to the boundless achievements. My childhood in village Adi saw villagers, they walk miles for the healthcare. MBBS, Government Medical College Jammu, Masters at AIIMS Delhi in hospitalization, then left my clinical practice, chose to heal systems, not just individuals. So, breaking boundaries in healthcare. I got opportunity to go for the WHO fellowship in USA for 3 months. Was involved in international projects at Bhutan, Nepal, United Nations, Global Fund. And when I was working with the Global Fund, I got the opportunity to bring $129 million for Ministry of Health, Government of India. I designed national ambulance code in the country, which was not there, for making the standards for the ambulances. Worked on different aspects of procurement, patient safety and governance. Established 2 state-of-the-art hospitals in Bhutan and played a very crucial role in setting up the 7-story trauma center in Kathmandu, Nepal. That shaped me, challenged me, and ultimately changed the course of my journey. Efforts makes a difference. When I was in class 12th, my father had a plan. Beta business karega. But I had a different dream. I wanted to be a doctor. So I made a promise to myself. If I have to become a doctor, I must put in my very best. Otherwise, I will be sitting on a grocery shop. I told my parents, मुझे सब subjects के लिए tuition चाहिए, including English also. In 1973-74, I used to traverse 12 to 15 kilometers every day in every kind of weather of Jammu. Every stop, every class, every late night traveling was not just about marks. It was about proving to myself that I could do it. Because in the end, extraordinary effort does make all the difference. The real boundaries are in the mind. When we hear the word boundaries, most of us picture fences, borders, limitations, but the strongest boundaries are not physical. They are in our minds. Once I was watching TV program where Professor P.K. Dave, then medical superintendent of AIIMS Delhi, was seeing off Abdul Ghaffar Khan, popularly known as Bacha Khan or Badshah Khan. That when he was seeing him off, that inspired, and a thought came to me. Will I ever get a chance to work at AIIMS Delhi? It felt far away, out of reach. I was just another doctor, sitting miles from Delhi with nothing but a quiet dream. But exactly 1 year later, I walked through the gates of AIIMS Delhi, not as a visitor, but as an assistant professor. That moment changed me. Do not let boundaries define you. Let your dreams redefine the boundaries. A dream beyond childhood boundaries. I do not remember the exact day I decided to become a doctor because I was too young to even spell it. We were just 12 students, 8 girls and 4 boys in a class. Whenever we played doctor to doctor, I was always the doctor because that deep down I knew this was not a game for me. It was a glimpse of who I wanted to be. We did not have fancy toys at that time, so I made my own medicine. How? mixing red and blue ink with water with each other to create syrups and injections at that time. It was messy, but it was hilarious. But to me, it felt real. So that little boy did not fully understand what it meant to save a life. But he knew one thing: he wanted to heal. And years later, when I walked into the medical college, I realized something beautiful. The dream had not changed, only the tools had changed. Now, blessings are also very important. I was serving patients at the government allopathic dispensary codes and was trying to help whosoever I could. While interacting with one patient, an elderly lady, about 70 years old, she smiled at me and said, "बेटा, तू बहुत बड़ा doctor बनेगा." At that time, I thought maybe in 10 years or 20 years, I will become a block medical officer. That was my big dream at that time. So, but something about her words stuck to me. They felt more like blessing than a compliment. And over the years, I achieved more, not just because of the hard work, but because of the power of our words. I still remember that words in my life. Skills matter, but efforts, they also matter. But sometimes it is someone else's faith in you that takes you beyond boundaries. Because, yes, blessings are also very important. Now, I want to share with the students and ask them, dare to dream, dare to be different, and dare to be beyond boundaries. Because the world does not need more of the same. It needs those who can see beyond and rise above. Beyond boundaries means redefining healthcare. Now, how we have redefined the healthcare by going beyond boundaries. I am standing here today not to talk about what healthcare is, but what it can become when we dare to go beyond boundaries. Healthcare is not just about treating illness. It is about breaking the boundaries of access, boundaries of affordability, boundaries of infrastructure, and boundaries of imagination. So how AIIMS Jammu went beyond boundaries, I want to share few aspects. We went beyond physical boundaries. That is the infrastructure at record pace. AIIMS Jammu made operational in just 3.5 years with 43 buildings and world-class infrastructure, earning the Best Project Award. We did not wait for conditions to be perfect, but we created them. Now, these are the milestones and roadmaps starting from 1st of August 2024. And in a year or so, we have started actually almost all the specialties, 33 in number, both general and specialty, and then actually starting the OT, ICU and other facilities also in just a gap of about 1 year. This is our glimpse of the North Campus where it is an institutional hospital is there. So this is our South Campus where residential and sports complex is there. So our motto in AIIMS Jammu is patient first. What are we are giving? Keeping in mind the requirements of the patient. We want the patient should be comfortable when he comes to the hospital. We have created a pain-free AIIMS. On 31st of January 2025, Honorable Lieutenant Governor Shri Manoj Sinha declared AIIMS Jammu as a pain-free hospital. Our idea behind this pain-free hospital is when a patient comes to the AIIMS Jammu, he should keep the patient pain beyond the hospital. Once he comes to the hospital, it becomes our responsibility to make him comfortable and he should not feel pain in the hospital. No, there are certain clinical milestones in a 1 year which we have done. So more than 280,000 patients we have seen in the OPD, 4,500 admissions, 1,500 emergency cases were managed, 2,000 plus surgeries. ICU provided advanced care to 930 critical ill patients. 800 plus life-saving dialysis has been conducted in AIIMS in over a span of 1 year. Now, there are certain things which are very unique and first in region. In this region, we have introduced and established the most modern state-of-the-art green smart waterless lab. That is a eco-friendly advanced testing facilities. We have established a cancer care center for chemotherapy, radiation and immunotherapy under one roof. At AIIMS Jammu, we are not just catching up with the world, but we are leading in the world. Now, we have also established Center for Advanced Genomics, which is very unique among all AIIMS, offering services that earlier required samples to be go abroad. As on today, this is the only facility which is available in Jammu, not in even AIIMS Delhi, not in other AIIMS. This sample used to be sent to USA costing 5 to 7 lakh rupees. And same facility has been provided in AIIMS Jammu at 15,000 to 1 lakh, 1 lakh rupees. So this is something unique which we have introduced in Jammu. Now, beyond boundaries of traditional patient care, not just OTs and ICUs, we have a compassion-driven system. We have actually provision of patient care managers, patient care coordinators, Rogi Sahayak Mitras, indoor patient navigation system, shuttle services and SWAS app. So these healthcare managers and coordinators, they are the link between the patient and the administration and the doctor. Beyond the walls of the hospital into the community, AIIMS extends its services beyond the hospital to the walls of community through the community outreach programs, reaching villages with the digital health records, ABA IDs and telemedicine. AIIMS Jammu is going to establish a community outreach center at Basoli, which will cater to 1 lakh population by posting doctors, nurses, resident doctors, staff, students, and other staff, so that actually we reach near to the patient's doors. AIIMS Jammu shaping the future of healthcare. So from 50 students in first MBBS batch to 100 students every year, from nursing to post-graduation in medicine, surgery, MCH program have already been started in 1 year time. We are not just shaping doctors, but we are cultivating the next generation of leaders. We want our doctors, our nurses, our resident doctor students, they should be trained to become the leaders in their own organizations who are going to be the next generation leaders, our future leaders. Then actually, we are also actually today AIIMS that starts as a hub of education, then innovation and inspiration. We have started a very different type of program, which is only program in our country with IIM Jammu, with IIT Jammu, where actually we are giving MBA in hospital administration and healthcare management for professional management of healthcare institutions. So that actually starting from 45 and reaching to 90 as on today with 100% placement. Now, recently there was a survey conducted by Outlook magazine Independent. AIIMS Jammu has been listed in iconic education institutions to look for in 2025 by the Outlook magazine. Then AIIMS Jammu has secured 7th rank in Outlook magazine's 2025 Government Medical University ranking across the country, and second highest among all AIIMS in our country, which is about 23, second highest after AIIMS Delhi among the 23 AIIMS. Now we have one of the most modern state-of-art digital library where we have provided a corner for the children also. Then actually we are also actually providing discussion rooms which are soundproof so that the researchers can work over there. Then we have also produced most modern actually resources are there actually. So we give a smart card with the password to the students, to the faculty. Sitting at home, they can access our the electronic resources of the library. AIIMS Jammu has become a learning hub. So there more than 30 schools have visited AIIMS Jammu. We are inviting all the schools to send their children. And as far as research is concerned, in 1 year, we have already working on 130 research projects. And our faculty has brought funding from ICMR and other sources from 25 crore to 1.5 crore, 2.5 crore. AIIMS Jammu actively fosters a culture of research, inspiring your mind, young minds to pursue innovation and excellence. We have partnered with IITs, IIMs, and international universities and other allied institutions for joint research, innovations, entrepreneurship, startups, and training programs. The future of healthcare is not competition, it is collaboration. So in my journey across the decade in institutions, I have learned one thing. The boundaries are not just on maps, they exist in mindset. However, every once in a while, a place, a dream, and a vision like the one we have at AIIMS Jammu comes along to break these silos. Where are your boundaries? And more importantly, what will you do to go beyond them? Because the future will not be built by those who stay within the walls, but by those who dare to walk beyond the walls. So you all are very talented who are sitting over here. That is why you are here. Show your worth. This is the time. Your personality, your presentation, your conduct, your communication should look different. Time has no holiday. Dreams have no expiry date. Life has no pause button. So let us move forward and start from today. Our future vision beyond boundaries, shaping the future of healthcare, shaping the future of education, and shaping the future of innovations. We have already approved about 12 most modern center for excellence, but I will name two. One is a center for robotic and technosurgery, which we are going to start. And then there is a predictive medicine. Future is predictive. You can predict through this technology 25 to 24 to 48 hours in advance whether this patient is going to get a heart attack or he is going to get a stroke. AIIMS Jammu belongs to every citizen it serves. We will continue to heal, innovate, and inspire a healthier tomorrow. Now, these are some of my thoughts which I want to share with you. Then I like those students who are eccentric. Nobody wants to become eccentric, but I like students who are eccentric because they think differently and out of box. Only then they can bring innovation in their respective fields. So if you take a step forward, only then you can decide whether it is a wrong or right. If you don't take any initiative, then you will not be able to progress. The biggest challenge before us is how to make 48 hours out of 24 hours. Maybe by our multitasking, time management, and so many other things. I think we have to, I always feel that 24 hours which have been given in one day that are not sufficient to deliver the state-of-the-art facilities. People feel sky is the limit, but we believe above sky is the limit. That is a infinite. Because real achievers do not stop where others do. They rise, they redefine, and they lead. So these are some of my points which I wanted to share on this very important topic, that was the boundaryless.